Hello, I'm Dr. Mark Dailey. If you're watching this DVD, then someone you know sincerely cares about your health. During the few minutes I have with you, I'm going to give you an overview of the kind of conditions I treat, as well as the most common causes of these conditions. Of course, it's impossible to diagnose your specific condition without seeing you in person, but I'll give you an idea of the possible causes. I'm also going to tell you a little bit about myself, so you have an idea who I am in the event that you choose to come in and take advantage of the offer at the end of this recording. You'll also hear from real patients who have benefited from care in our facility. We will touch on the type of treatment we offer as well as some treatment options. As for me, I was raised in Miami, Florida. I have 7 kids altogether. I got my chiropractic degree at Life College in Marietta, Georgia. To become a chiropractor, I took 4 different national board examinations and 2 state board examinations, one in Georgia, one in Alabama. I moved to Alabama in 1997 to work with one of the top SOT practitioners in the country. I worked with him for several years, opened this office in Springville, then another office in Hoover. At this point, I'm in Springville 6 half-days a week, and in Rainbow City 3 afternoons a week. I love what I do, and I'm passionate about helping people enjoy healthy living. Now, I'm going to say a few things that may seem like I'm against the medical profession, but nothing could be further from the truth. My grandfather was a medical doctor and a strong influence on me. He was a cardiologist and the chief of staff at Mount Sinai Hospital in Miami, Florida. My sister is a pediatrician, and they're both warm and caring people. Now, I have had the pleasure of personally helping thousands of people over the course of the last 13 years between our Springville, Hoover, and Rainbow City offices. We've addressed conditions from headaches, migraines, neck pain, carpal tunnel syndrome, upper and lower back pain, numbness and tingling in the hands and feet, fibromyalgia, chronic fatigue syndrome, and many more. Over the last few years, I've consulted with a number of companies to help them reduce spinal injuries in the workplace and show them how to minimize an injury when one occurs. Companies like Coca-Cola, Bluebell Ice Cream, Miss Stratton's Salad, Stewart Machine Shop, Merita Bakery, Elastic Corporation of America, Spring Air Mattress Company, Tricon Metals and Services, Prax Air, Webb Styles, Industrial Galvanizers, Valspar Coating, Revere Control Systems, Stevens Graphics, NTA Graphics South, Certainty, Roan Incorporated, Nexcel, J Mid-South, Regulus, Choice Fabricators, and Keystone Foods. Now, as you can see, the list of companies I've consulted with is long. Now, you can look at letters of recommendation from these companies. You can view them online at workplacewellnessonline.com. Now, most people who come into my office actually have an underlying condition that's causing their pain. It's usually a structural misalignment that predisposes them to have back or neck pain, or whatever symptom they're experiencing. Let me give you an example of a structural misalignment. If you were driving a car with the front end out of alignment, your tires would be predisposed to wear out quickly in places they weren't designed to wear. You could turn up the radio so you don't hear the noise of the tires. You can change the oil, you can flush the radiator, but anything short of having the front end of your car aligned will do you no good. Now, in the same respect, if your spine is misaligned, it'll cause the discs and the vertebra to wear out before they should. This is called degenerative disc or joint disease. This actually causes a cascade of problems which might include muscular imbalances, muscle spasms, inflammation, which in turn can cause stiffness, decreased range of motion, nerve irritation, which may result in a burning, a tingling, a throbbing, a numbness. It can be sharp and stabbing or a dull ache. But if you do in fact have degenerative joint or disc disease as the underlying cause of your pain, the medical profession in general would suggest that you take pain pills, anti-inflammatories, muscle relaxers, that you might have a nerve block or even spinal surgery. But anything short of bringing the spine back into proper alignment, just like the front end of the automobile, won't fix the problem. Your spine will continue to wear out even if you're unaware. Now, I don't want you to be misled. This is a progressive degenerative disorder, which means it gets worse in time, not better. Now, let me be honest. People come to see me because they're in pain. Their motivation is to get free from pain, period. What they often find is that they have this underlying condition that must be corrected, or their future will most likely be filled with persistent, chronic pain. What I see in these people over the years is that their pain gets more intense, and that the bouts with the pain tend to happen more frequently.
I've heard it said that a picture is worth 1,000 words, so I want you to actually see what the degenerative process looks like. What you're looking at is the degenerative process from left to right. To the far left is a normal cervical spine. To the far right is stage 3 of the degenerative process. Let's talk about the x-ray to the far left. What I want you to notice about this x-ray is that there's a very smooth curve and consistent disc space. The space or the dark line between the white squares are the discs, and the white squares are the vertebra. When you have the proper curve, the bulk of the weight of your 15 to 20 pound head is distributed evenly on the posterior facets, where the arrow is pointing on each individual vertebra. Now look at the x-ray to the right of this one. This person is in phase 1 of the degenerative process. What I want you to notice about this x-ray is that this person no longer has the proper cervical curve. You'll notice the upper arrow shows that this person's head has shifted forward. Because his head has shifted forward, he no longer bears the weight of his head on the posterior facets where it should be, but now the load has shifted to the front of the vertebra, which will lead to premature wear of the discs and vertebra. Notice that although this person has lost the proper curve, his head has shifted forward, he still has fairly consistent disc space. In time, however, that will all change. Now look at the x-ray to the right of this one. This is phase 2 of the degenerative process. What I want you to notice here is the loss of the proper cervical curve, and especially the decreased disc height where the red arrows are pointing. It's important to understand that as the disc space decreases, the hole the nerve root comes through becomes smaller, which makes it more likely that the nerve root will be irritated or pinched. If the nerve is pinched in the neck, it can give you headaches, neck pain, sinus trouble, shoulder pain, even numbness and tingling in the hands and fingers. If the nerve is pinched in the back, it can cause upper back pain, mid back pain, low back pain, hip pain, leg pain, knee pain, even numbness and tingling in the feet. Now, let's turn our attention to the film to the far right. This is phase 3 of the degenerative process. What I want you to see here is that there is no proper cervical curve. The head has moved forward. There is decreased disc height, and now there are spurs or calcium deposits on the front of the vertebra. The red arrows are pointing at them. And this is why I urge people to have their spines checked. If you have any of the symptoms, it's vital that you don't put it off. At least find out what phase of degeneration you're in, and of course see what can be done about it. I want you to take a closer look at an individual vertebral segment with me so you can see it in greater detail. In the top picture, there are 2 healthy vertebral segments. On the bottom picture, there are 2 segments that have already had degeneration set in. Notice on the top picture the thick, healthy disc, which again is the cushion between the bones. You can also see that the vertebrae are nice and square with no signs of wear, and you can also note that the nerve root is coming through the hole between the vertebrae. This is the way it should look. As you turn your attention to the bottom vertebral segments, you can see that the disc is almost worn completely away, and the nerve root is now compromised, and you can see the formation of bone spurs as well. This can be a very painful ordeal for those suffering with this type of progressive, chronic, painful condition. Please don't let this be you or a loved one.